dental materials that are comparable to natural enamel or to natural dentin. These are still the best materials that we have. And nowadays, we always prefer minimally invasive procedures that can conserve more the original tooth health structure. So these direct restorations are, in essence, the most conservative option that we have in operative dentistry, and the best option that we can offer to our patients when we want to be conservative. This is a direct composite case. This is the baseline, and these results that you have seen, this is possible because of the evolution or the revolution of adhesive technologies and dental materials. And with this kind of approach, we don't need to do more extensive or more retentive preparations to do our restorations. We simply add to the tooth the absent structure, and we can make works like this long-lasting. This is a 5-year follow-up. The case looks really nice, and hopefully we will have these restorations on the road for more 5 years. I think there will be no big problems. Later I will share with you my maintenance protocol, the one that I use. How do I follow up these patients? And I really believe this is a very useful, effective option for our clinical practice. So in this context of biosubstitution, let's analyze this case. This is a young girl. She's a 23 years old patient, and she was referred to me by the orthodontist to improve her smile. As you can see, there are some problems with this display, anterior display. It is clear that we can do some aesthetic improvements, and normally for these kind of cases, I like to do a digital smile design where I can decide how am I going to change the size, the shape of the front teeth, and also the gingival display, take it into account the ideal aesthetic proportions. So we did the planning, the digital planning, and prior to the wax-up fabrication, we tested this smile design virtually in this extraoral photograph, as you can see, and this is very easy. You can simply cut and paste new teeth into the patient's mouth, and we can observe the aesthetic integration, gingival zeniths, shapes, size of the teeth. And once we have patient's approval, we can fabricate the wax-up and eventually do an intraoral mock-up to test this planning. So this is very important. This will guide the wax-up, but this will always guide the surgical procedure. As you can see, we have drawn the new shapes of the tooth